Gillette Children's Specialty Healthcare is an independent, not-for-profit specialty children's health system located in Minnesota, in the United States. With a unique focus on complex musculoskeletal and neurological conditions, Gillette transforms the lives of patients through clinical research, advocacy, and world-class care. The patient is at the center of everything we do. Innovations in clinical care at Gillette are driven by the needs of the patient and supported by a multidisciplinary team to offer the best possible outcomes. In 2024, Dr. Mark Dahl, pediatric orthopedic surgeon at Gillette, performed a 2-stage arthroplasty with hip distalization for a high hip dislocation. It was only the second time the procedure was performed in North America and required special approval through the Food and Drug Administration, the United States federal regulatory agency, which oversees safety, efficacy, and security of medical devices. This case is one example of Gillette's unique focus and unwavering commitment to the needs of each patient.
When something is a new innovation and it's been done on a dozen or so cases like this has been done, it does not yet at this point have FDA approval. And if you have something that doesn't have FDA approval but you believe it's the right thing to do for your patient, then you do what you apply for humanitarian device exemption or compassionate use. So we go through quite a process to inform the FDA what the technique is, how it's been used, how safe it is. Professor Rainer Baumgart is from Munich, Germany, and he and I have been friends for years, and he's a very innovative, creative surgeon, and he's actually the developer of a lengthening device that fits inside the bone. And bone lengthenings prior to this time were always done with an external fixator. So Professor Baumgart came up with a tool that was a telescopic rod that goes inside the bone, and nothing is external to the body. And it's controlled by radio frequency waves, which are essentially the waves that we use for a garage door opener or remote control for your appliances at home. So he combined his efforts as an innovator in developing this technique with hip replacement surgeons in Munich, Germany. And what he did was he developed a way to make a temporary cup for the lengthening rod and attach the lengthening rod inside the femur bone to this temporary cup. Once they're stretched out to the length that they're supposed to be, we go in for a second stage of a procedure that's usually 5 or 6 weeks later. And we take out the temporary devices and put in the stem for the femur and the ball and put the hip into socket, and the patient has a total hip replacement. Limb lengthening and deformity correction is a very unique subspecialty of a subspecialty. So pediatric orthopedics is a subspecialty, and within pediatric orthopedics, limb lengthening and deformity correction, and the team that we have here at Gillette is very unique. What we have at Gillette in regards to limb length and deformity correction surgery is a core group of surgeons and staff that focus on this day in and day out. So we have a team of surgeons that is doing this, and we're surrounded by vital people, nurses, therapists, technicians that help us. It's a fabulous place to work and a fabulous place to do difficult work.
Pediatric orthopedics is just one of the many disciplines in which Gillette Children's is driving advancements in patient-centered care. Gillette's subspecialty areas span orthopedics, physical medicine and rehabilitation, neurosciences, and complex pediatrics. Whether they're pioneering the next era of rare disease research or leveraging the latest technology to improve surgical outcomes, every day, teams across Gillette bring their creativity, skill, and expertise to unlock new possibilities for those they serve. Families from around the world turn to Gillette for answers informed by over 125 years of clinical data and solutions, fueled by the brightest minds in pediatric care.